I am the publisher and editor of Fun and Fit Life magazine, funandfitlife.com. I'm here today with Dr. Pierce and inquiring about his anti-aging medicine. I am a 52-year-old man who has tried to be healthy and exercise for a long time, but I'm starting to feel the effects of aging, so I've decided to have a conversation with Dr. Pierce and see what he can do to help me out.
Over the years, I mentioned earlier that I've always been working out constantly, almost religiously for years, and now that I'm 52, I notice that my workouts don't have the same effect on me that they used to have, as far as how I feel after my workouts. Sometimes I don't even feel like working out, but I get to the gym, and I do, and my energy level come in, and I have a decent workout. I understand that our body starts to produce fewer hormones, testosterone, whatever, and as those levels decrease, it affects the way we look and feel. We get older. We don't function as well. So, how would you start me in a program? What kind of test do you do first? A blood test, I'm assuming, and after after you get those tests, then you decide, you know, what I'm short in, and what does an anti-aging regimen look like?
Fair enough. So first off, you've mentioned some symptoms that are definitely associated with a decline in hormone production. Number one, your energy levels going down. Number two, the fact that you're putting forth the effort in the gym, you really haven't changed your exercise or your diet, yet you're seeing diminishing returns, maybe even an increase in body fat, with everything else being equivocal. And you ask yourself, I've been eating the same way, I've been exercising the same, yet I look worse, I feel worse. Why? And generally that's related to hormones. It could be dietary and supplements, they could help as well, but 9 times out of 10, especially in somebody who's in their 4th or 5th decade, when they notice that decline, generally hormone related. Our first step to determine that is through lab work. We do an extensive blood panel, and we check out your general health. We look at a cardiac risk factor panel. We also look at your hormones. We look at your thyroid. We look at your growth hormone. We look at testosterone, estrogen, dihydrotestosterone. In women, we also look at all 3 types of estrogen. We also look at cortisol. And we try to find a balance of those hormones. Once we can balance those out, people generally feel better. You mentioned youthful levels, and in our practice, we look at optimal levels. And the way to determine an optimal level is by patient response. I.e., if you have a testosterone level of 500 and you feel like $1 million, you have great energy, you have great libido, your sex drive is great, muscles are hard, firm, no problems, then that's an optimal testosterone level for you. But if your level's 500 and you're gaining weight, you're tired, your sex drive is terrible, all these symptoms that we mentioned earlier, then 500 is not an optimal level for you as an individual. We need to find that optimal level. So we get the blood work to find out your baseline. We also ask you extensive questions to find out what is your true symptomology. And we try to treat the symptoms by improving the hormones.
Okay, I understand that.
Ultimately, our goal is to keep you as active and as healthy as possible for as long as possible, so that way you can live your life to the fullest and enjoy life to its fullest extent.
Does that mean all these little aches and pains I'm starting to get? I feel like my joints are starting to get a little bit weaker. I get shoulder problems or knee problems. Is there any kind of, in your experience with the medicine, does it slow down those processes, or does it help those processes? Is there hope that perhaps those aches and pains won't be as bad?
In a lot of patients, yes. Unfortunately, not everyone has that effect. But with proper supplementation, nutritional and diet and exercise, those things will all benefit those symptoms. When you start to look at hormone balancing, if you're low in testosterone, you're low in growth hormone, a lot of those symptoms that you are feeling are side effects from the low hormones. We bring those hormones up to optimal levels, a lot of those issues go away.
Is your anti-aging regimen, if I were to do this, and I am going to do this, is the
is it more than just hormone replacement? You give a lot of counseling on nutrition and supplementation?
Most definitely, most definitely. Nutritional supplementation plays a huge role in this. I kind of think of if you're holding on to life with one hand, and life is a bar, you're holding on with one hand, you have a few different things. You have hormone balancing, you have diet, you have exercise, nutritional supplementation, and brain wellness. If those are your 5 fingers, and you're holding on, and you start to take 1, 2, 3 of those away, and you're only holding on with 2 fingers, you're not going to hold on for very much longer.
Right.
So if we incorporate all those aspects together, we find better balance, and we can improve issues, improve lifestyle, improve life.
You give me your favorite health tip, nutrition or
Sure.
diet-wise,
Sure.
for the people who watch this and our readers?
Sure. I'll tell you, if you're not taking fish oil, in my world, I think it's the #1 supplement. If you're going to take no other supplement in the world except for one, it should be fish oil. Recommended daily dose is 3 to 4 grams a day. Make sure you get a good quality fish oil. One of the ways to tell is if you're burping up fish, you probably don't have a good fish oil. Fish oil does wonderful things for us. It helps to balance out our cholesterol, makes the good cholesterol go up and the bad cholesterol go down. It's a great anti-inflammatory, not only anti-inflammatory for the joints and muscles, but anti-inflammatory total body on the inside of the blood vessels, thus reducing risk factors for heart attack and stroke. Omega-3 fatty acids in fish oil are essential for brain function. Basically, we can't live well and healthy without omega-3 fish oil.
Very good tip. Now, can I put you on the spot?
Sure.
Do you have a favorite 1 or 2 that you would recommend, or do you sell?
Fish oils?
Yeah.
Yeah, we have, what's that, Nordic Blend?
Nordic Naturals.
Nordic Naturals. They have a really good product. Pure Encapsulations, here's a good fish oil. Life Extensions has a great fish oil as well. So there's 3 of them for you.
Very good.
They're all really good quality.
Okay. So we'll be back in a few weeks, and we'll update my little journey here of taking care of myself.
Cool.
And you can share with us another tip at that time. Appreciate your time.
No worries, thank you.
Okay.
If you have questions concerning anti-aging medicine, you may call Dr. Pierce at 702-838-1994. Check back in a few weeks for another conversation with Dr. Pierce.